Hi, I'm Dr. Shook. I'm a board-certified chiropractic physician here in Hickory, North Carolina, and today I'd like to talk to you about a pinched nerve, what that is, what that means, and some of the things that you might want to consider doing to try and help yourself with that problem. So a pinched nerve is where basically the nerve that leaves the spine gets compressed. Okay, so let me show you with a model pretty simply what this is. So this is a healthy lower back. These are two bones of the spine. They call their vertebrae, and this spacer between that is called the spinal disc. Now, the things that you see that are yellow back here, these are nerves that leave the spine between each of the bones. Okay, so you have this at every level. The nerve leaves the spine between the bones. The disc gives it height and separation for this hole back here. So you see the nerve comes through the hole. There's a nice open hole, and then the height of the disc helps to make that hole stay open. It gives it the height and the space. Okay, so one of the things that happens to people very commonly is that these nerves get compressed. Now, there are a few different reasons for this. The most common reason is actually a disc bulge or disc herniation. Now, we're going to talk about them as if they're the same thing, but they are different. But basically what it means is that material in the disc. So when we look at the disc, you see it from the front here, but if we look straight down on it, so if we could take the vertebra off and look straight down, this is what you would see. Okay, you would see the jelly-like center of the disc. You would see this outside wall, which is actually this tough cartilage that has a lot of different layers to it. And you would see the spinal cord above. So this is the spinal cord. It travels down the spine. And then you would see the nerves, how they exit at each side between the bones of the spine here. So you see it's coming out. This is the one above, this is the one below, and then this is the one below that. So this is what you would see normally. These nerves can become compressed, and probably the most common way is a disc bulge, where that jelly-like center right here the disc wall starts to break down, and that starts to move, and it puts pressure on the nerve. So let me show you what that might look like. So this is obviously a spine that's not as healthy. You see the disc is not as thick. There's some jagged edges here because there's arthritis that's forming. If we looked at it from the top, you notice there's a big difference in the disc that we saw earlier, right? See this disc, right? Big difference. They look different. This material, the material inside, is moving backwards. So this was actually, if the material migrates and moves like that, it actually, unless it comes out of this outside wall, unless it breaks through, it's considered a bulge. If it breaks through, it's considered a herniation. And a herniation would look more like this. You would see this material that's squirting out, that's really putting this nerve under pressure, and that can create a lot of, let's say it's in the leg, a lot of sciatic pain down the leg, even into the foot, numbness, tingling, weakness. It can create a lot of problems. This is what we would see here. Now, the other things that can cause this nerve to be pressed, other than a herniation, other than a bulge, where this material moves back and maybe compresses the spinal cord, maybe compresses the nerve, is osteoarthritis or degenerative disc disease. When this disc breaks down and gets thinner, so it's a lot different than it is here. See how thick that disc is? It's much thicker. Here it's broken down, it's lost its height, and that's caused the hole right here, where the nerve comes out, it's caused the hole to lose its height, to get smaller, right? So you notice the difference here. You can look at the two. See the difference? There's a big difference in the size of the hole where my finger is here. It's a much smaller hole, and that can cause narrowing and compression of the nerve. Now, that can also cause that arthritic compression can cause sciatica and nerve pain as well. These are the most common reasons that we see for nerve pain, for a pinched nerve, things that cause a pinched nerve: disc bulges, disc herniations, and arthritis that grows in. Now, a lot of these cases we can help and we can work with. Some of them we can't. And so the important thing to know here is, the approach that we take is very non-invasive. The tools that we use, my favorite tool for these types of problems is something called non-surgical spinal decompression therapy. And don't be intimidated by the name. It's a very gentle way that we can gently put you on a specialized table that's computer driven and very gently put a little bit of pull into your spine, unload the spine, and what it will do is it will create a gentle separation that opens up the hole for the nerve, so it takes pressure off the nerve, helps to improve fluid movement through the disc, which can help it to heal. It drops the pressure, which can actually pull and help to retract that material that may be coming out back towards the center, taking pressure off the nerve. So it helps to decrease pain and improve function. It's called non-surgical spinal decompression therapy. It's absolutely my favorite therapy for these types of problems if you're a candidate, and that's a really important question. It's a really important thing to understand. Not everyone's a candidate for this. This is definitely a non-surgical approach. We've worked with hundreds, if not over thousands of people with this exact approach. But it may be, it's one of the reasons we do an exam and we really look into this. It may be that you need actually a surgical consultation. It does happen. Or that you need advanced imaging before we can move forward with any type of care in our office. You might need an MRI or something to let us visualize it and what's actually happening a little bit more closely. But I hope that helps you better understand some of the things that we see that cause pinched nerves and nerve pain in our office. If you need any help or if you'd like an opinion on your case to see if we might be able to use some of our advanced therapeutics to help you recover, decrease pain, and improve your function, and just have a better quality and quantity of life, then just give us a call. Our phone number is 828-324-0800. If you want to check us out and learn a little bit more about us online, go to hickoryspine.com and you can learn a lot more about what we do. But I appreciate you. Hope you have a wonderful day and look forward to meeting you soon. Thanks.